Hello, everyone, and welcome back to another episode of the NexGen HealthTech Podcast, the place where we explore real-world innovation in digital healthcare, one conversation at a time. Today, I'm thrilled to welcome a very special guest, someone who brings both deep clinical experience and forward-thinking insight into how digital tools are transforming patient care. Joining us is Dr. Stoyan Stefanov, a leading specialist in cardiology with a modern approach to healthcare, known for blending evidence-based treatment with patient-centered care. He's currently practicing at one of the best cardiology hospitals in Bulgaria, Sveta Ekaterina, and his reputation for staying ahead of the curve when it comes to integrating digital solutions into daily medical practice makes him the perfect guest for today's discussion. So we're going to explore what innovation looks like from the ground level in global healthcare, big challenges, and dive deep into how physicians can remain both human and high-tech in their approach to care. Dr. Stefanov, welcome to the show. It's a real pleasure to have you here today with us. One question that I was delighted to ask you as the first one was, where did your journey start in healthcare? Why medicine and maybe also why cardiology in specific?
So it's a pleasure for me to participate today. I'm thankful for the invitation, and I think the topics that we will cover are really important in order to draw the outlines of the future in the medical field. But let's start with your opening question. I really like this one. How did we get here? How did medicine come into my life? It was really a long time ago now, because it is a passion which forms maybe around the high school years. When it starts, it has to come from within. You really have to have a passion for the medical field in order to prosper in it, because it's difficult, and if you don't have the passion for it, it loses interest, and it's hard to stay in this field. For me personally, I looked at different futures around my high school years, but I came across the medical field maybe by chance, because no one in my family is a doctor or something related to it, and I didn't have the personal outlook for this specialty. But when it came across the possibility to work in this environment, it really came from within, the interest and the passion for this work. This is mainly what drew me to it, because I at first thought it was difficult. It was a lot of chemistry, a lot of biology, a lot of studying. For the whole time through medical university, there are more than 50 exams, and from the beginning, at first, every student which starts knows this is very difficult, and not many of the students actually graduate. So this the specialty requires persistence, and if you don't love it, it will get the best of you, and you will drop out eventually, because it really is a hard specialty. But in my case, I really loved it. I loved the adventure. I loved the hardness of it, because if it was easy, it wouldn't be so interesting. So this really drew me toward it, and especially cardiology. I have to say, we study in a university a bit of every specialty, and cardiology is for sure one of the hardest, and in a theoretical way, it is one of the really hard specialties, because there are a lot of books you have to read. There are different fields in medicine, like surgery and others, in which you are not so required to read thousands and thousands of pages of books. But cardiology specifically is the field in which we have most statistics, and it is really theoretically oriented as well as practical. And this is the main reason I loved it, because it's not only practical, it's not only theoretical. You have a combination of both worlds, and it's what drew me towards it and ignited my passion. Also in university, we have a lot of practical examinations, a lot of practical stuff, and this helps you to get oriented which is best for you, not only by reading books, but also working it in the field. And to have this contact with the patient and to gain the trust within the patient. And this is the first step of our work. This is also something like a skill you don't read in books. It's something you have to have from within to communicate with people. In our specialty, cardiology, I think a big part of our work is also to do something like psychology connection with the patient and help them mentally, not only physically. So it's really complex, really difficult, and I like challenges. So this is my passion, not my profession.
I love what you said about if it's not easy, it's the journey is more satisfying at the end. So I completely agree with this point. And while we're on the topic of challenges, what do you see as the biggest challenge in digital transformation when it comes to hospitals? What challenges do they face today in integrating technology and different types of solutions in terms of digital healthcare in today's hospital world?
Well, I see that today's hospitals, especially in our country, Bulgaria, they're not at all modernized. See, most of the hospitals think they're living in the last century, and the way they're doing things now is the same way they have done it 20, even 30 years ago. Most hospitals even use the same techniques, the same stuff they used decades ago. They are not looking forward. They are not in line with the modern trends, and this is a big problem. In medical terms, we call this medical inertia. Inertia is a big problem in the way of modernizing hospitals and our practices because not all, most of the hospitals, the personnel that works in them, they're like older people which have practiced decades, and they know what they know, and they have difficulties learning new stuff. But medical field today, it's really dynamic and it's closely related to the technological advancements. Even 5 years ago, it's not the same as today, and it will not be the same 5 years from now. But this accelerating advancement of technology is, I think, the main challenge for the medical field, to not lose track of the advancement and stay up to date with the new technologies. This requires constantly to evolve, and in other countries they have something like continuous medical education. This requires the medical specialist to do every year a certain course to learn the new stuff and to be up to date. But this is only in a few countries, and in many we have only the personal need to grow, and most of the specialists don't have this from within, and they lose their capabilities with the medical inertia and what they have studied a long time ago. This is what they know, this is what they will practice until the end of their career. So I think medical inertia is the main difficulty which we have to overcome in order to free ourselves from these boundaries and just evolve head to head with the technological advancement.
I absolutely agree with you. And when you mentioned inertia, what comes to my mind, for example, is this huge burden, I think, on digital healthcare professionals and professionals also in hospitals. Is in today's world, you mentioned that technology is not that still, it's something that's coming into hospitals, it's evolving, but as you mentioned, it's not yet evolved to that stage where it's well integrated and everyone is using it. So one inertia, one burden that I've personally explored is, for example, administrative burdens in healthcare. So what do you think that, automation, for example, AI and technology can help elevate, alleviate this type of burden from healthcare professionals in terms of handling documents or administrative tasks in general?
Well, I think this is the future. Today's world, the reality is that we, the medical professionals, we have a lot of paperwork, a lot of documents we have to organize, we have to fill forms, and maybe in some fields, the work which a medical professional does is at least 50% documents. this is not what we have studied for. This is not our field, and our powers are not filling out forms and documents. So I think this is a huge waste of medical power, which is wasted on administrative tasks. These tasks are not specifically have to be done by medical specialists, and the fact that medical specialists are doing them, I think it's a waste of their capabilities and a waste of time. If we have 50% administrative tasks and 50% treating patients, I think it is a huge opportunity to optimize the process and leave those administrative tasks at the hands of the AI or some software to do it automatically, because this is not some high-end and very specific tasks that is required to be done by a medical specialist. And if it really comes the day when those tasks are alleviated from our daily life, we will have probably at least double the time to be treating our patients and to help the patients more, because the reality is that every year the administrative work is getting harder and getting even more and more, so there is less time to help the patients and more time to fill the documents. I think this model of overcoming this problem is really what AI is great at: to check the documents, to fill out the documents autonomously. So there is no need to be wasting time with such mundane tasks. Now, the reality is that a lot of hospitals, a lot of medical centers hire personnel, which is non-medical personnel, to do this administrative task, but they are wasting money because the people they hire, they need to have a salary and a place to work. So if those administrators are replaced with software, we're even optimizing the working space. There is no need to have an office for the secretary. It is a virtual office for the software, and we will have more room to do medical and treating tasks. So I think this is a huge opportunity in the modern life, which we are obliged to welcome in our medical field, do what is necessary to implement it and use it in our future, because it will help not only the medical professional, but will help also the patient, which will be in the center of our work, not as it is now, the documentation.
Yeah, I absolutely agree. And doctors' time should be more focused on their practice and on the patient. So this is a very, very important topic. I see even nowadays that a lot of like you mentioned, a lot of doctors are focusing more on paperwork after procedures or surgeries, and then, handling records than actually paying attention to the practice itself. So I completely agree with you on this point. It needs to be more patient-centered. And in terms of patient-centered, do you think that, for example, telemedicine can play a role in in-person care diagnostics? Can AI help, further, develop the diagnostics in healthcare and help professionals to have a better diagnostics overall? And how does this method help your work and the patient itself?
Of course, I believe that the implementations of AI and all kinds of software in our medical day-to-day work is not only administrative tasks and paperwork. This is mostly the basic thing that they can do. But also, I think AI will greatly evolve and help us with the diagnostic part and also the treatment of our patients. So it is a complex relationship between the medical professional, the AI software for medical purposes, and also the patient. I will give some examples in which I think AI will be really useful in alleviating some of the tasks of the medical professional. I believe that AI can help in ambulatory medicine, also in hospital medicine, which are different fields, also in the surgical theater where operations are done. I really cannot think of one medical field which will not benefit by AI and software enhanced features, but I will give the perspective from my point of view in the cardiology field, because this is what I do, and I can give personal examples in areas of cardiology where I think AI will be greatly beneficial. When it comes to the ambulatory work and the cardiologist, which is the first line in treating the patient, the ambulatory cardiologist, not the in-hospital cardiology. There are a lot of machine learning software and chatbots that can help us diagnose and gather information from our patients even before they enter our cabinets, because the patient calls the telephone and wants to schedule a meeting with the cardiologist. Now the administrator tells him, so come next week in this hour. But this is it. After the patient comes, the work starts in my office. But this doesn't need to be this way. When the patient calls the telephone, can also, besides get the appointment, there may be a chatbot with features which ask the patient what is the reason for this consultation, what disease do you have, what are your complaints, what medication do you take, what are your symptoms, maybe get some results if he has some laboratory examinations also. And the chatbot may gather all kinds of information for this patient, not only schedule a meeting. And after 1 week, when the time for the meeting comes, the patient enters my office and I am not starting from ground zero. I have all the information that the chatbot has gathered and it is systemized, and I know a lot of stuff for this patient even before he comes through the door. And when he does, I'm focusing on the important stuff, and I already know what is the problem, or at least I have some idea about the problem, and I'm not wasting time gathering this information myself, because the chatbot is perfectly capable of gathering it autonomously and summarizing it, and I have this bonus afterwards. I save time and I mainly focus on the diagnostic part, which is really perfect because it cuts half my time for the examination, and I can help twice as many people in one day if they use this type of chatbot.
Absolutely. Maybe here, one very interesting question also for our listeners and viewers would be, you mentioned that these types of technologies can help patients within hospitals, but also outside of hospitals. What do you think about, for example, technologies like wearables, AI within those wearables, remote patient monitoring in hospitals and outside of hospitals, different gadgets that can be used, video monitoring? How does this help professionals, but also how does this help the actual patients, which are, for example, in the hospital and outside of the hospital, being monitored remotely by their doctors and being, one, I think, more at ease and being more mentally calm, that they have these types of technologies which could signal either the doctor, the hospital, or they can get in contact with the doctor himself for various, cases. Like, for example, if they have some kind of a symptom that's out of the ordinary, or they're a little bit more stressed about what their condition is at the moment, if they have any kind of an important question to the doctor himself, but also from the doctor's perspective, monitoring a patient outside of the hospital and inside with more technology, for example, remotely monitoring them. How does this help the doctors and the patients from both perspectives, from what you think and what you've experienced so far?
I think this is the next step of the implementation of AI-assisted medical help, because what I gave as an example for the previous question, this is probably, so to say, active work. The patient calls, and this is something the patient has to initiate to do the activities with the chatbot. But what you're now giving as an example, the wearables which gather information, this is more like a passive thing, which the patient is not required to do anything. This is autonomously 24/7, and it is done passively by the software in the wearable. So the patient doesn't have to move a finger. This is perfect for the patient because he is living his life and he doesn't have to invest time or energy to do this type of screening and information gathering. This is passively done by the software of the wearable. I think the first step, which is already in use worldwide, is the ECG monitoring from some types of smartwatches, and some information which is gathered can be used to screen for deadly arrhythmias. And if the watch is registering irregular heartbeat, it automatically is connected with the medical specialist and is alarming him that his patient has irregular heartbeat. So the medical professional can call his patient and schedule a meeting. This is something that the patient doesn't have to lift a finger in order to be done, and is a really great way to screen for this type of arrhythmias, because in our field of cardiology, some type of deadly arrhythmias like atrial fibrillation, they are first registered after the incident, which can be a deadly stroke. So we are saving lives with this kind of automatic data gathering. But this is only one example of something which is already in use. I think this is only the first stepping stone, which will evolve in time. And those types of wearable devices can gather all kinds of information, not only about the rhythm, but also about blood pressure, about blood saturation, about breathing, about sleep quality, about steps and activity during the day. Heart rate variation also is very important. And I think this will drive even the technology industry to produce different types of wearables with different capabilities of gathering data, in order to diverse the type of data which is gathered, and really do the work automatically, because now the patient is actively in need to do the work. I think this type of wearables and software will in the future step further and further in this task, and will relieve the patient from this work and do it automatically, which is perfect for the patient, because not all patients are so actively seeking medical exams, and are really don't do the prophylactic lab checks, and only go to the doctor when it's in the last minute and the disease is really progressed. So those types of patients with low compliance will have the most benefit when it comes to AI assisted wearables. And we will save millions of lives, I believe, if we implement it in our daily practice. But it is the future, and I think we have to embrace it and work in this field with the idea that technology is coming, and we have to let it help us, not fight with it.
Absolutely. And you mentioned that this could be a huge benefit for high risk factor patients. But also on the other side, maybe you have patients which are more centered within their health and how they want to improve their health and their lifestyle, their habits, etc. So in this case, how do you view people, for example, who are young? They're trying to get in shape, they're trying to eat healthy, but they also want to monitor their health more closely because maybe they have some kind of risk factors which are inherited, or maybe they just want to track their lifestyle, their how they're eating, how their daily routine affects their health. So in this case, let's say they consult their cardiologist in terms of heart health in this case. And how could these types of solutions improve long-term health and monitoring a person's lifestyle and everything he does on a daily basis, and consult with his cardiologist and the tools provided like wearables and other technologies that we have some at the moment, but I'm sure they're going to progress to more advanced options in the future. But how does this help a person maintain a more healthy centered lifestyle overall on a daily basis long term?
I think this is a great question, and I first would like to start with some different implementation of the use of this software and the data. There are some patients with serious diseases, so we can use software to monitor the disease progression and exacerbation of the symptoms. But this is only one group. Maybe another group is the patients which have which have risk factors. They want to monitor the risk factors, and they want to check constantly if those risk factors have evolved into a disease, because risk factors eventually lead to a disease. So they closely want to monitor not only the risk factors, but check if disease is present. And another group is patients which want to use this type of software and wearables to better their health in order to get a more healthy lifestyle. They don't have disease, they don't have many risk factors, but they want to use these devices to stay risk factor free. And on the other part of the spectrum of the disease, we can get an example with patients with athletic advancements and athletes which want to use this type of software to better their performance in the sport they're practicing. So across all of the spectrum, from athletics to diseases and everything in between, this type of data from wearables and AI generated statistics will help the people, not only patients, because patients have disease, but athletics, it's they're not patients, they're athletics with advancing sports capabilities. AI will help them also, because they will closely monitor what they are eating, how is their resting heart rate, how is their sleep going. All things which are sports related, they can be gathered and AI generated into summaries, which are now done either by the athletes themselves or their trainers. This is taking time and effort from these people, and also if an athlete is hiring a trainer, he pays him. But if it is software which helps him, it can greatly reduce the cost of this type of information gathering. So I think there are huge implementations in a broad spectrum of cases, and only time will show how it will advance, but I don't see any other way personally, also in prophylactic, but in the disease as well.
Yes, I really like what you said about the perspective for athletes. And I think nowadays, at least for the past 10 years, what I've personally seen, and I think this is a case on a global level, that a lot of athletes are under more pressure than usual. They're training harder than before. Sport is becoming very performance based. So you see a lot of even young athletes having sudden cardiac arrest or arrhythmias or any other types of issues because of their hard training, maybe the supplements that they're additionally taking, their very hard schedules, maybe lack of sleep. So this is from the outside perspective. We have the wearables, we have different technology that can monitor them on the outside. But how do you think that these types of technologies like AI, different types of softwares, maybe diagnostic tools as well, like different software products, can help cardiology on the inside when we talk about surgery, diagnosing them within the hospital itself? How do you see things moving in this direction?
Well, I would like to add that it's really from the outside when we talk about the wearables, but even today we have some devices which are implantable and help to gather information from within the body of the patient. One thing which I really like is an example, but we don't have it in Europe, unfortunately. It's only applied in the US and it's approved by the FDA. This is an implantable pressure monitor which we implant in the pulmonary artery of heart failure patients. This monitors the pressure within the pulmonary artery of the heart failure patient, and when the sensor registers high pressures within the pulmonary artery, this is a clear sign of exacerbated disease, progression of the heart failure. This is something the patients may feel, may not feel, and we are not depending on the symptoms, but this pressure monitor wirelessly connects with the patient's phone and sends a notification to the cardiologist, and cardiologist immediately knows that this patient has a progressing disease and calls him immediately to get to the hospital and get balanced by medication. And this really saves lives, because some patients, they come late and the effect is not so good. But this type of monitoring, it's also an example of passive monitoring, because the patient doesn't have to do anything. It's automatic. I think this is in the future only going to get upgraded and not only gather pressure information, but there are currently in research some implantable microchips in some different blood vessels with the capabilities of gathering information about blood count and different biomarkers in order to do automatic blood check results. So the patient is not required to go to the laboratory and get his blood drawn and lab tested. This is something within his body and can be programmed to check all the parameters which we need automatically every week, every other week. And if something from the biochemistry or the blood count is outside the reference parameters, it immediately sends a notification on the phone and through it to the medical specialist. This will only help the patient and also the medical specialists, because from my point of view, if patients come early and on time, it is greatly helping the treatment, and the outcomes are more positive. If we lose time and the patients come late and have really progressed disease, it impacts negatively the outcomes, and the treatment becomes longer, harder, and even more expensive. So this type of active monitoring of different variables within the body with implantable devices will cut costs and will greatly benefit the outcomes of the diseased patients, and not only the disease, but those with risk factors, cholesterol, blood pressure, diabetes, and other things. With diabetes, we have those type of monitors, but I think in future they will progress and they will gather even more and more data about the status of the biochemistry within the body. This is something which can be implemented on all people, but in hospital we have severely diseased patients with different needs in comparison to the broad spectrum of the average person. In hospital, maybe we'll have the need of different kind of technology and devices because the needs of the patients in the hospital are more severe and different, and the technology used in hospitals have to apply different kind of variables. And now we have monitors in the intensive care units. I think it is the easiest way. The monitors, they already gather all types of information. We just have to do a centralized server probably, or computer which gathers all the informations from all the monitors and summarizes it and processes it, so we can have a summary about every patient and automatically alarms us for different events and parameters. We don't have to do a visitation and do all the rounds actively going through the corridors in every room, and the medical specialists have to check every parameter by himself and write documentation about it. This really is a waste of time, because this can be done automatically with software, and the medical specialists can have this type of information summarized and sent to him in case of pre-programmed event. This can send him a notification and he can focus only on the events, and someone else will gather the information. This will be the work of the software.
Absolutely. I think that the first thing that comes to my mind when you explained everything is this saving of time at the end of the day can save someone's life. Time is everything for doctors, and mostly this is highly important for patients. On-time care, on-time reactions is something that's of number one priority in hospitals. and for doctors and patients. So I think this is something that's highly important. I think all these tools can help both patients and doctors save times and save also lives at the end of the day. So when we speak about all these types of opportunities and challenges, what is your perspective from what you've seen so far in your practice? What are the biggest challenges in implementing these types of technologies in hospitals? What are the the main blockers, I would say? And then what do you think would be the next advancements in digital healthcare, in cardiology, but also maybe in other aspects also? How do you view it within the next few years as well?
Well, in the case of what is stopping us from implementing the technology, I think we can say there are probably three main factors. One factor is the medical specialist himself, because of the medical inertia, which is a big problem, especially in older practitioners. They don't want to progress, they don't want to learn new stuff, they don't want to implement new techniques. They know what they have practiced. They have the tools they have learned so far, and that's it for them. They don't have the motivation to learn anything new. And the medical inertia, I think, is the biggest problem from the medical specialist point of view, but also the patient's point of view. Many of the patients fear new technology, and especially in cardiology, our patients tend to be older and from a past generation when they didn't have any technology, they didn't even have internet, smartphones. Those kind of things, they are afraid of them actually, and when they come to the hospital, they want to get help, but they want the person-to-person interaction. When it is technological stuff, it is not known for them, they don't understand it, and they actually fear it. So one is the medical specialist's point of view, another is the patient's point of view, but the third side, I think, it's the regulatory organ in the country, because our medical practice, which we do day to day, it's mainly driven by some rules and some regulations that we have to closely follow, and those rules and regulations, they are brought down to us by the law and the government, and some people decide how we are going to practice our profession. I think the first step of changing these day-to-day practices has to come from the government body, which is regulating our work practice, and they have to say it is mandatory. We have to use this technology. We have to implement AI, and this will force even the medical professionals and the patients to implement it in our practice. But it has to come first, I think, from the government regulation, and they have to apply it because the rules now are more like paper-based documents. We even don't have enough digital documentation. It's the other way around. We have to do everything on paper and store tons of paperwork in archives decades from the past, which is not the way we have to advance. I think those three factors are the main difficulties we have to overcome. But if the regulations which come from the government are not changed, I don't see how the medical specialists can do it by themselves, and even the patients. I think the government has to give the lead, the medical specialists have to follow, and afterwards the patients will have no other choice but to use this new kind of medical technology. And after they use it, they will overcome their fear of the new, and they will like it. But if it's not forced on them, I don't think they will choose it in front of what is now the person-to-person interaction. Because especially in cardiology, I'm repeating myself, but the patients are older and they have skeptical views about the new stuff, and they are afraid of change. So someone has to force it in our field in order to implement it more freely and broadly, and not part of the hospitals. We have to do it widely in order to have the effect we are seeking, because only if one or two hospitals which are more progressive, if they implement it, the others don't, the effect is only partial and we lose a lot of the benefit which we can gain. And about the other part of the question, how I see the future a few years from now, I really think we have the tools to do the changes we want and to implement AI and chatbots and software enhanced features and wearables and data transferring between the gadgets and the medical professionals. We have those tools, and other fields like IT and investment and crypto, even many of the fields outside the medical field are using those tools actively and gathering the benefits. But especially in the medical field, we have the tendency to slowly accept new things and be cautious about the effects they have on our work. This is one of the reasons which leads to such slow implementation in new technology in medicine. Almost all of the research which is done in new medical techniques and new medicine as well, the research has a long follow-up period, about 5-10 years, to check about safety, check about long-term effects, and even if there is some new type of technique or new type of medicine, we have to make sure and study it at least a decade before we implement it in our work, which is a lost time. I think from one hand we have the safety parameters, but we're losing time and losing patience. I think AI in modern life is advancing quickly, and we have to adopt. We cannot wait 10 years from now to check its safety, because 10 years from now this AI will be completely different, and what we're going to do then, we're going to check the new AI features for another 10 years, and we're constantly losing track of the modern technology and falling more and more behind the new features. So I think we have to change the concept and rethink our safety concerns and embrace this new technology freely and without such fear. And I really think in the next at least 5 years, this is one of the main things which is going to change, the fear of the new technology and how we embrace things and implement it directly in our practice, and not follow it up for decades before we decide to do it after thousands of research, because this is not how the world is going nowadays. Everything is dynamically changing. The speed of progression is getting faster and faster. So we in the medical field also have to change gear and do things and change our practices even faster and faster, not to follow behind the other industries. And the focus has to be on the patient, because what is going to be most beneficial in this advancement is the help which we can give our patients, and the benefits for treating our patients will be the most major factor in this change.
I completely 100% agree with you. I think we need more young healthcare professionals like yourself, which are driving within this direction. And this will eventually cause more people to think this way and cause a wave. At the end, it's happened also in the past. It's always about when something new, it's scary, but we have to test and see how it is before we judge it. So I completely agree with you on this point. And for anyone out there who wants to learn more about Dr. Stefanov, you can visit the links that we've provided on this episode and in the links below. Thank you so much for sharing your perspective. I think that your perspective is something that we need to strive for. Thank you for sharing your time and insights with us and your truly grounded perspective on how digital healthcare is evolving, not just in theory, but in day-to-day practice as a professional who's there in the field and is working with patients every single day. So if someone wants to learn more about Dr. Stefanov or even book an appointment, we've provided some links below and on screen. So, at the end of the day, conversations like this remind us that innovation in healthcare isn't only about technology, it's about trust, it's about access and improving real human experience. And if you've enjoyed this episode, don't forget to follow us on LinkedIn and other medias like YouTube. And if there's any professionals out there or anyone working in digital healthcare or professionals like Dr. Stefanov who would like to be featured on our episodes and have a talk about the future of digital healthcare and the challenges, please do so. And thank you once again for listening and watching.